Hey, making a YouTube video. Just so tired of being in the house. Welcome back to my channel. Hopefully you could hear me. I'm talking kind of low because I'm outside filming today. I just wanted to get out of the house so bad that I decided to do this video outside. So today I wanted to share a couple of videos that I found yesterday when I was doing like more research on coronavirus and, you know, looking at Facebook and just seeing what everybody was talking about. And basically it has came out that that's why I shouldn't do nothing outside, because it's so distracting, y'all. It's so distracting, but I'm gonna try to get through this anyway. They're saying that black people are at a higher risk of having complications from the virus, right? So Dr. Fauci, well, it had came up. So in the briefing yesterday, one of the reporters asked Dr. Fauci about, you know, the issue, and he responded and basically, you know, confirmed that yes, black people are suffering disproportionately to the coronavirus. So look really quick at this clip from the briefing from yesterday on what he had to say about it.
To follow up, you talked about African Americans and how they've been disproportionately affected by the coronavirus.
Seems to be, unfortunately.
Do you plan on requiring the CDC, any federal agencies or state agents, public places doing tests, and private companies doing tests to collect that data on the race of the people being tested and the race of the people being treated and outcomes?
Well, we're just seeing tremendous evidence that African Americans are affected at a far greater percentage number than other citizens of our country, because we're dealing with our country. Now we're looking at it from a worldwide standpoint. Tony Fauci is looking at it very strongly, but these numbers have started to come out, and they're very strong, and they're pretty obvious. I mean, you're talking about...
You will release that.
Would you like to talk about that for a second, please?
I think one of the things that we're going to be doing with our Medicare data is to do that analysis. We're going to look back at the last month or so and look at, you know, related type illnesses going forward. We now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor. We can also look at what the underlying health issues are as well. So we'll be providing that data very shortly. But we will be doing that analysis.
We're working on that very hard. This is something that's come up over the last... I hadn't heard this, and then over the last few days, this has come up more and more. And I don't mean by a little bit. I mean many times. It's a real thing. Now, we want to find cures. We want to find therapeutics. We want to find vaccines, because that will solve everybody's problem. But why is it that the African American community is so much, you know, numerous times more than everybody else? And we want to find the reason to it. And Dr. Fauci, Seema, both of them, and others are working on this. And they're going to have very good, I would say in less than a week, I think you're going to have very good statistics. A couple of days.
Something specifically aimed at those communities that are being hard hit, those black communities.
Well, we're helping them a lot. But what's happening is we're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the black community as opposed to other people? It doesn't make sense, and I don't like it. And we're going to have statistics over the next probably 2 to 3 days, okay?
Mr. President. I just want to make a brief comment to get back to the discussion about the health disparities in the African-American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis, like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma. Those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end. We will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Okay, so you heard what he said. Basically, it's not that Black people are getting the virus more than others, it's that we're suffering once we do get it more than others. Because y'all remember they said people with compromised immune systems are at a higher risk of having complications. And like he said, Black people, for whatever reason, have a health disparity. Now, I don't know why, but we have hypertension, asthma, diabetes, and obesity more than other races for whatever reason. You know, I don't know if it's because of our genes, because we just lazy, because we like to eat, whatever the case is, because we don't have health care, because we, you know, are poor, because whatever the case is, you know, Black people have all these extra health conditions, you know, that other people apparently don't have. And honestly, I really didn't know that. Technically, I knew like some diseases were found in Black people. I think like lupus and different stuff like that, but I didn't know that more Black people have diabetes or obese or you know, whatever the case is. I don't think that they're trying to attack Black people. We are more basically at a higher risk of having to be in the ICU or needing a ventilator or whatever the case might be. And here's a good example. So on the news yesterday, they was talking about a lady, she was 57, let me see, a 57-year-old admin for the police department in Fairburn. It's about 20 or 30 miles from downtown Atlanta, so not too far from where I'm at. She got sick on a Wednesday, you know, not feeling good, had the symptoms, whatever the case might be, went home on Wednesday, was not getting any better, went to the hospital on Friday and died that same day, and she was Black. So, and I remember when I seen that story, I was so shocked. Like, when they showed her face and she was actually Black, I was just like, wow. Like, you know, y'all know at first they was saying that Black people can't get it and da da da, but now I'm seeing so many stories of Black people having it. Like, even that lady that was volunteering to use her, because she recovered. It's this one Black lady in New York that recovered, and once you recover, obviously your body is immune to it. So they was using her blood as a way to like do something, basically use her blood, because now her blood has antibodies in it. So they was taking her blood to take the antibodies out to use it to try to find a cure and a vaccine, and you know, to get more information about it. Hey, making a YouTube video. Okay, y'all, I'm back. So yeah, so real quick, let me show you the news about the 57-year-old lady and her situation. Let's look at this.
20 people in Georgia. We learned today one victim worked for a local police department. Cheryl Catrone passed away 2 days after complaining of being sick. The mother of 30-year-old twin daughters ultimately tested positive for COVID-19. Fox 5's Carrie Charles spoke with Fairburn police about the department's loss.
A major blow to Fairburn police. On Tuesday, the department announced one of its own died from coronavirus. Cheryl Catron, a 57-year-old administrative aide, had been with the department for about a year.
For it to hit so close to home, you know, right here in our Fairburn family, as we've been saying, it's very, very difficult to deal with. It's really hard.
How is this news affecting the morale in the department?
A lot of the officers have been upset by this. You know, it's they're all understanding the dangers of continuing on with the job they're doing.
A family member I spoke with told me Catron went home from work sick on Wednesday, then was admitted to the hospital on Friday and died the same day. Could you talk to the importance of why the department waited to share this information with the public?
We want to be truthful. We want to make sure we're getting the information out there accurately. And I think that the most appropriate time to do that was after we had a test result.
What's the message people need to take from this?
Take it seriously. Stay home. Don't go out if you don't need to. This stuff, it's the real deal. It's very, very dangerous.
The deputy chief says 7 other administrative workers and all of those who had direct contact with Catron are now home in quarantine. He added that the administrative offices are closed. Also said several officers wanted to be tested for COVID-19. Well, they all had negative results. You can learn more about how you and your family can support the Catron family by visiting fox5atlanta.com. Carrie Charles, Fox 5 News.
See, so ain't that crazy? She looked like you or me, looked like, you know, your auntie, your mom, anybody. It's just so crazy how in 2 days you can literally pass. Now, in the article, they didn't say that she had any type of underlying health condition. So it really don't explain why she would die so quickly, but she must have had something going on. I mean, she had to, And then also, but then on the brighter side, like, I don't want this to be like, some sad video about blacks and how we gonna die. That's not what this video is. So I did want to bring you a lighter story about a black guy. Again, here he was in Albany, Georgia, which I'm not sure how far away that is from Atlanta, but it is in Georgia. Albany, Georgia is where most of the cases in Georgia came from, but he recovered. This black guy recovered, and they are attributing it to hydroxychloroquine. I think you probably heard the president talk about that. The hydroxychloroquine is starting to rain, y'all. I'm gonna have to hurry up. The hydroxychloroquine, I don't know how you pronounce it, but I'm gonna show y'all the clip on that one too, and just listen to the doctor because he gonna say the name of it. But they said that people are getting better due to the hydroxychloroquine and the azathioprine medicine. I don't know, y'all. I'm gonna show a picture for y'all. So yeah, there is hope. Don't think that if you black and you get it, you're gonna die. That's not the case. They do have medicines, these two right here, that they are using in the hospitals to get people to feel better. So real quick, look at this news clip about the black man that recovered from the ICU, from the ventilator, and went home.
Completely recovered. And News at 9, Cindy Santifani spoke with the chief medical officer at Phoebe Healthcare Systems about the release of the most recent COVID-19 patient and what aided in the process.
There's been a lot of discussion about people contracting the coronavirus, but what about people who are recovering from the coronavirus? Fortunately, physicians over at the Phoebe Memorial Hospital over in Albany have attributed 2 drugs to the recovery process, azithromycin and hydrochloroquine, which have been said together have aided in the recovery of patients suffering from COVID-19. Harold Jenkins is one out of 340 patients in Albany who made a full recovery from COVID-19 since the pandemic hit, and the numbers keep getting better.
Just in the month of March, we've had about 54 patients who had been admitted with COVID-19 who have been discharged since the first of the month.
Most people with COVID-19 have mild illness and are able to recover at home without medical care, while severe cases like Harold Jenkins often receive supportive care in the hospital, according to the U.S. Centers for Disease Control and Prevention. For harder to combat cases, Phoebe is utilizing 2 specific medications that are aiding in the recovery process.
The vast majority of patients coming into our facility, we are using a combination of 2 medications called hydroxychloroquine and azithromycin.
As of Monday, nearly 280,000 people worldwide have recovered from COVID-19, according to data from the Johns Hopkins University dashboard. That number will only continue to rise if people practice the CDC guidelines, according to medical professionals like Dr. Kitchen.
I don't think it's a battle that we're going to win in the hospitals. I think the way we're going to defeat this is by being fully compliant with those public health measures, which have been proven time and time again over the years to be effective.
I'm telling you, it's been an experience.
While Jenkins says his experience with coronavirus has been an interesting one, he is now back home with his family. Physicians do say for those who contract the virus, most people see a 2 to 4 week recovery time. But after, those who do not suffer from immunocompromised systems do usually make a full recovery. Reporting in Columbus, I'm Cindy Santifani for WTVM News Leader.
Okay, y'all. So see, there is hope. There is hope. And there actually was another, and it's real weird. And I'm not trying to be on no conspiracy theory, but there was another guy from Phoebe Putney Hospital. If that name sounds familiar, it's because that's the same hospital that nurse, remember the one that quit? She was on social media talking about she quit because she got a compromised immune system and they sent her to the coronavirus floor. She was at this hospital that you just seen, the Phoebe Putney. She was at that hospital.
I'm not trying to be unprofessional. I'm upset. I just quit my job.
This emotional video of nurse Melissa Scott quitting her job has gone viral.
My manager sent me to a floor that is being tested for corona. She knows my health history. She knows all of this. I quit. I care about the patients and all, but my family and my life, they matter. They come first.
She worked at Phoebe Putney Memorial Hospital in Albany, known as a hotbed for COVID-19, with a total of 647 positive results and 29 deaths. And we've recently seen other social media posts.
Like I said, that's where most of the cases is, and that's why she didn't want to be there. But, and what was I saying? But Oh my God, my memory, y'all. What was I even saying? It's another black person out of that hospital, the Phoebe Putney Memorial Hospital in Albany, Georgia. They showed it on the news. He was a healthy bodybuilder, but he was a black guy. Healthy bodybuilder, came down with coronavirus. Health went downhill fast. They had him in the ICU. They had him on the ventilator, but he got better and was released. He was actually one of the first people they released from the hospital. Now, I tried to find that article, but it's so weird because I cannot find it. It's almost like they don't want you to know about the good cases and about the recoveries and about the people that's coming out of the hospital, which is really weird. But yeah, so people are recovering. People are making it out of the hospital. They're not killing you when you go into the hospital. And as far as like going into the hospital and them giving you coronavirus, I don't think that's the case, y'all. If anything, they're giving you this hydrocoquine and this azathioprine. And the hydrocoquine, the reason they're using that is because I think it was a treatment for another virus or another disease. So they figure like, well, since it worked on this one, let's try it on this. But yeah, y'all, that's pretty much it for this video. It's kind of starting to rain, and I just wanted to get something out to y'all. But yeah, as far as the black people, it is true. The numbers, they said based on the numbers, we are being affected more for some odd reason. You know, they claim it's because of our health disparities due to our pre-existing conditions. I saw one video that was saying that, you know, all humans are different species and we all come from different places. And y'all know how they try to say that black people are like from monkeys and different stuff like that. So if I was gonna have a theory, it would be that maybe, what if black people, like, what if we were made from like monkeys and gorillas, and since our DNA is from an animal, that's why when it get into our system, it affects us more. What y'all think? I don't know. That's left field. That's kind of left field, but it makes sense because all humans are not the same. You know, we all have a different genetic makeup. But yeah, it is true. Y'all saw the video. Y'all saw Dr. Fauci. So black folks, definitely stay in the house, y'all. Stay in the house. And if it is affecting us more, it's because we cannot stay home. You know, not because we hard-headed, but because a lot of us, we gotta work. You know, a lot of us can't just sit at home. A lot of us, you know, paycheck to paycheck. You know, we can't be sitting around waiting on this money they claim they gonna send. They've been claiming that for some weeks now, you know. So if we outside 9 times out of 10, it's because we probably don't have nowhere to go. You know, it's not because we want to. Trust me, if somebody could sit at home and do nothing, they would. The reason we out here is because we don't have no choice. But anyway, y'all, make sure you subscribe to my channel, and I will see y'all on the next video. Bye.